Next, let's start a bolus of lactated ringers. To document this, we will use the Intake tab, not Medications. All non-compounded formulary items going into an IV are found in this section. Note at the bottom you will see the sections for blood, colloids, crystalloids, and other intake. Choose crystalloid, and then double-click on the lactated ringers 1000 milliliter IV solution. Note that this fluid has defaulted to infusion, and we can type in our milliliters per hour. Let's start the bag at 500 milliliters per hour and backdate it again to allow us to play with the record. To change the rate of your fluids, the process is the same as the drug infusions. However, you have two new options to explore. First, by right-clicking and choosing Enter Incremental Value, you can document that since the bag was started, 300 milliliters have infused. This will automatically calculate the rate based on the amount infused and the start time. When you are ready to start a new bag of fluids, you can also right-click and choose Change Bag. The system may ask for you to accept a rate change that reflects the entire bag was completed before the new bag begins. In the same manner that you are able to modify, remove, and add medications, the Intake button on the toolbar mirrors the functionality of the Medications button. If you now desire to remove the lactated ringers administration, click on the Intake button, and you can remove the administration from there. Documentation of the output is accessible through the toolbar or through the toolbox next to the Intake button. The options available when selecting output include estimated blood loss, cell saver discard, gastric tube output, and urine catheter. The documentation window and function is the same for all these types of output. We will demonstrate documenting estimated blood loss in today's example. By double-clicking, the output documentation window appears. On this screen, you have the option to document your blood loss in incremental values when needed, or as a total at the end of the case. When documenting in increments, you select your time and document this output multiple times in the case. By doing this process and then launching the window again, you will see now that the total blood loss begins adding together the incremental values. You also have the option to choose the site that the loss is occurring from in the drop-down box below. After all documentation is complete, choose OK. One difference to note is that removing output documentation requires you to use the toolbar. By selecting Output from the toolbar and the radio button Remove Output, you are able to clear the documentation. It is important to understand that intake and output documentation integrates with the patient's record outside of surgery. By populating the intake and output, we maintain a complete history on the patient's fluid volume. Anesthesia is responsible for this documentation from the time of entry into the operating room to the handoff with the PACU nurse. After the case is complete, this information populates to all other shared intake and output view and should not be re-entered by the next provider.